dexamethasone and an antiviral drug, and his doctors say he is doing well. From Washington, Nomia Iqbal sent this report.
I came here, wasn't feeling so well. I feel much better now.
No big rallies, no crowds of supporters, but President Trump still has his Twitter following inside the hospital. After the chaotic handling of the messaging about his health by his staff yesterday, the president clearly decided to do the job himself and released a long, unscripted update on his and the First Lady's health.
I want to thank everybody. Our First Lady is doing very well. Melania asked me to say something as to the respect that she has for our country, the love that she has for our country, and we're both doing well. Melania is really handling it very nicely.
He even avoided mentioning China, as he usually does when it comes to the virus.
We're going to beat this coronavirus, or whatever you want to call it, and we're going to beat it soundly.
But there were also uncharacteristic signs of hesitancy from a normally bullish president when it comes to his health.
So I just want to tell you that I'm starting to feel good. You don't know over the next period of a few days. I guess that's the real test. So we'll be seeing what happens over those next couple of days.
After his performance yesterday, the president's doctor tried once again to reassure the American public that the president is really on the mend.
As with any illness, there are frequent ups and downs over the course, particularly when a patient is being so closely watched 24 hours a day. We review and debate every finding, compare it to existing science and literature, weighing the risks and benefits of every intervention.
And if he continues to look and feel as well as he does today, our hope is that we can plan for a discharge as early as tomorrow to the White House, where he can continue his treatment course.
There's been a real show of support outside the hospital here for Donald Trump, which he says he's grateful for. But the messaging from the White House is causing real confusion about when he fell ill, who he may have infected, and what that means about the president's health.
From his team and family, the message remains that he's getting on with his job and he's in charge. But the numbers of cases of people falling ill around him are going up. The latest in his circle is the former governor, Chris Christie, who checked himself into hospital last night. He was at the Rose Garden ceremony last weekend for the Supreme Court nominee Amy Coney Barrett. It may turn out to be the super spreader event. For the time being, President Trump has to stay inside. He says campaigning for the election hasn't stopped, though. Operation Make America Great Again is in full swing.
Hello, hello.
And it's also ramping up on the rival side, with Democratic candidate Joe Biden hitting the virtual trail last night. Both men were meant to meet in 11 days' time for the next presidential debate. That looks increasingly unlikely now. Instead, the next few days will be dominated by the question of how ill the president is and when he'll be able to return to the fight to hold on to the White House. Nomia Iqbal, BBC News, Washington.
Well, here we are awaiting the release of the latest figures on new confirmed cases of the virus and deaths. Yesterday, there were almost 13,000 new cases reported, close to double the previous day's figures. The government has said that that was due to a technical glitch that had prevented